The radiohumeral joint. This is something you want to consider in conditions like lateral epicondylitis, radial tunnel syndrome, posterior interosseous nerve syndrome, stuff like that. And so the way you do that is you have the patient kind of grab onto your hips right about here, and you're going to just have them relax their arms and feel right where the radius is hitting the humerus. So right underneath the lateral epicondyle here is where my finger is, and you're just all you're really feeling for is side-to-side comparison of if there's more of a gap on one side compared to the other. And typically the side that I'll treat or say is compressed or distracted is on the involved side. So go ahead and lie down. She felt a little distracted on this right side. So then when assessing the elbow further, you can actually look at abduction and adduction of the elbow in supine. So you take them into full flexion and have them, bring them into, this would be abduction of the side, and you're trying to mark where that pinky is compared to the shoulder. And then you flip the hand around now in pronation and go into adduction and look at that. I typically do side-to-side comparisons to look at any differences that stand out right there. Now, since we said that it looked like she was distracted here, to compress, you basically just kind of stabilize the humerus and then you rotate while providing a compression force through the radius. Now, if we were to say she was distracted or compressed already and we want to distract it, you grab onto the humerus here and stabilize the humerus and grab onto the radius, and as you're supinating, you're providing a little traction. And then go ahead and reassess the joint to see if you got the changes that you needed. Something to consider.